Hey there, today I want to talk about a really important issue that often flies under the radar: corruption in the healthcare systems of underdeveloped countries. It's a serious problem that impacts millions of lives, and it's high time we shed some light on it. So, what does corruption in healthcare look like? Well, it comes in many forms. Let's start with, this is when funds meant for healthcare programs or infrastructure get misappropriated. Then there's, patients often have to pay unofficial fees just to access services, bypass waiting lists, or get essential medication. It doesn't stop there. Means overpriced or counterfeit medical supplies because of kickbacks. And don't forget, hiring unqualified staff based on personal connections rather than merit. Lastly, there are health workers demanding additional payments beyond official fees. Now, let's talk about the impact on public health. Corruption makes healthcare for the poor due to high out-of-pocket costs. Are another consequence counterfeit drugs and poorly trained staff put patient safety at risk. This all leads to when people lose faith in the healthcare system, they're less likely to seek care. And of course, we see marginalized groups are the hardest hit by corrupt practices. So, what are the root causes of this issue? It often boils down to, there's also for healthcare infrastructure, which creates gaps that corruption can fill. Make it easy for corrupt practices to go unchecked. And when healthcare workers aren't paid adequately, they might turn to informal payments to make ends meet. There are real-life examples that illustrate this problem. We've seen scandals involving the mismanagement of international aid funds, patients unable to afford bribes for essential care, and the devastating consequences of counterfeit drugs on patient outcomes. But it's not all doom and gloom. There are potential solutions we can look at. Strengthening oversight by establishing is a good start. Can encourage people to report corruption without fear of retaliation. Is crucial. Empowering local populations to hold healthcare systems accountable can make a big difference. And with the digital age, can help track funds and resources more effectively. International collaboration is also key. Supporting anti-corruption initiatives through global partnerships can bring about real change. In closing, corruption in underdeveloped countries' healthcare systems is a complex issue, but by understanding its forms and impacts, we can start a dialogue for change. Thanks for watching, and let's keep this conversation going.